it's not great in Dublin, but like compared to Mayo, it's like it's very hard to get to see a doctor in Mayo because it's so short-staffed, and you know you've one person doing all the medical cards in one area. In Mayo growing up, I had a GP, and she was a wonderful GP, but when I had mental health difficulties, she told me not to tell anyone because you wouldn't want people around town knowing that. There's a huge difference. I think people forget that things are a lot different in small town. Acceptance is completely different. Coming out to my GP was hard, you know, in Mayo. But up here, it seems like it's just acceptable to be who you are. Actually, when I went into psychiatric hospital when I was younger, I remember them filling out the form, you know, the inpatient form, and they never asked me. But I saw them like there was a gay and straight. I wasn't asked about any of this kind of stuff. So you have sex, male, female, sexuality, gay, straight. Mine was just female, straight. You know, nobody like, and I felt really like, sorry, stop making assumptions about me. You know, I'm 20 and I know myself right now.
I think that there was definitely a lack of communication about sex and especially about contraception, and I actually got the morning after pill when I was 16, I think, when I hadn't even had sex. I didn't really know who to go to or who to talk to at that age about anything like that. I kind of felt I was treated a little bit like a child, or yeah, kind of immature like a child, and I always kind of doctors would speak to my mum or about me when I was there, but not to me. When I was in college in Trinity, the healthcare service there was amazing, and I really got a lot of help there, and I got a lot of use out of it. I'm a little bit apprehensive now because after having left college, I don't really know who I would go to now.
If I was sick myself, I'd go to my mother because she'd obviously went through that. She knows probably what's wrong with me. I'd very rarely go to the GP because I don't feel like anything happens in the doctors anyway. Like you're not getting treated the same as everyone else. When down in Galway, when you go into the doctor, you just weren't giving you the time of day. You're being real ignorant towards you. Doctors probably think, well, she's a traveller, she doesn't care. Sure, she's pure, like they have an unhealthy lifestyle. So there is a lot of racist against travellers around.
Yeah, well, I had anorexia since started when I was about 12, 13, and when I was in school, I got no help at all with it. I told a few teachers, I talked to my GP, and it was just kind of this happens to everyone, like kind of like you're going through a phase kind of thing. Worst case I can think of was the first time I went to therapy, and I had to go through kind of the head doctor. Then I had to go see another doctor who dealt specifically with eating disorders, and then he passed me on to another doctor. So straight away I was being kind of passed through, kind of like it was nothing, it was kind of like I just passed her on. Well, you're not this enough, or you're not enough of this, or this is what you do, and well, anorexics do this and bulimics do this, and just follow this and you'll be okay, which is not, realistic. That's not how it works. You have to deal with each case individually. It was tough, and I feel sorry for anybody who's dealing with any mental health issues in this country, because I just think they're kind of totally forgotten about.